And I'm telling you that that's the answer to why. I mean, we just would like to slow it down enough to discuss it. Now, I believe there are some Republicans that just want to kill the bill, slow it down, and kill it. But that's not everybody. And I don't believe our leadership. I think if we were given the opportunity to sit down and legitimately give input, 60 amendments were offered by Republican members of this committee, and I think 2 were accepted. Maybe 2 or 3 were accepted. Now, there's got to be more than 2 or 3 good ideas out of that 60. So this hurry, when the thing goes into effect in 2013, actually after the next election. So, I mean, it goes into effect. So what I'm saying is that there seems to be plenty of time if you're going to have a 2013 effective date. Now, did a man last? Okay, yes, ma'am. Pink, right through there.
Thank you, Congressman. While there is a section in the bill that concerns me greatly, it's not called a death panel, but it's very much like the futility thing that was brought up, except there doesn't have to be a disagreement over what to do. I think the section
do you have that written down, that part?
I don't have the bill with me, but I remember it as section 1300 and something up to line 25.
Anything that has 1,300 sections is too long.
What it does is give the government the authority to make end-of-life decisions and to appoint the doctor to carry it out. That concerns me greatly. While it's not called anything, that says death panel to me.
I'm going to have to look at that. I do not believe that means that, but I'm going to have to look at that. I want to make sure I read that for you.
Also, in Texas, small businesses are allowed to go together and form coalitions, so they have enough people then to apply to a carrier to get big company
the
medical
realtors
discounts.
like to do it. A lot of groups like to do that.
It's
It goes
not
back to
being,
his point that unless you go across state lines, you
but that's all, that we can do that in Texas. Why can't we do it with individuals as well? If you got 500 people together to form a coalition, that's like having a company of 500 people. You can get really big discounts, and part of the premiums that are going up, it's not because the companies are raking in so much money, it's because our medical advances are jumping ahead so rapidly, it is extending our lives by decades, and with good health. And I don't think anybody here wants to go back 30 years and pay lower premiums. Well, I want that extension with good health. And it also, how can a doctor not charge more, a lot of money, so that the insurance has to pay a lot of money when his malpractice insurance is $250,000 a year?
In Texas, a lot of that's been remedied, but nationwide it is not. Thank you, ma'am. Right back here. Yeah.
Part of the problem with these alleged death panels, if you read the words of Ezekiel Emanuel, which is Brown Emanuel's brother, he's one of the advisors to the president.
Yeah.
Where he actually wrote that physicians need to consider using social justice when practicing medicine. So if Granny is not going to be viable, she doesn't get her hip surgery. Rather, spend those dollars on someone younger that's more viable.
That has been the experience in other countries that have gone this route. Again, this can be remedied in this bill, but that has been the experience in other countries that have adopted this kind of language. Let's see. Okay, yeah, good.
Thank you for letting us speak with you and
Sure.
sharing your thoughts. I really appreciate it. I have a lot of concerns about the bill. Some of them have been brought up here by this lady and that lady, and Sherry over there. Anyway, I haven't seen death panel either. I have read parts of the bill, and it's so hard to read that I kind of just went by notes that people had sent on emails and looked up the things and to see if they sounded true. All the scare tactics are very true in some cases. Anyway, end-of-life counseling every 5 years, if you're in rehab or whatever, every 2 years. That to me sounds like maybe you're ready to die. Maybe we should consider euthanasia. It doesn't say that.
Some days I'm ready to lay down.
Yeah. Yeah. Anyway, it doesn't say it, specifically, but and Ted Daschle and another Democrat had been on the news saying that seniors should realize they're not going to have the same care, and that they would have to sign some kind of end-of-life agreement or something. In England and other socialized countries, I've heard in England that if you're 59 or over, you cannot have any kind of heart surgery because they can't afford it. Let's let the younger people have the health care. I fear that that's going to happen here if this passes. Let's see, people from other countries actually come here because we have excellent health care here. It costs money. I know there's people that can't afford it. The country cannot afford it right now. We are in bad shape. I hate to, step on anybody's toes, but we are really hurting. We are going to be bankrupt if we do this. Let's see. More notes here. The computerization part of it. I don't like that all my personal information is going to be accessible by thousands, hundreds of thousands of people probably. Things that I don't want public. And I think it can be used against me. I personally think that if you're a Republican, it could be held against you by that panel of government people that are going to decide whether you deserve that. Okay. Bureaucracy costs a lot of money. Lots more money. When anytime things get anyway, when it's in a government bureaucracy, it's going to cost more. Doctors are going to make less. Doctors are going to quit working. They're going to have more patients. And we will not have the health care that we have now.
Thank you. That's good input. Yes.
My question is, it sounds like you're for some kind of reform in the health care arena. I'm curious what specifically you think needs reform and why. And I'd also invite you to pursue do you think it's better to break down the categories that need coverage, young people, elderly, etc. I would implore you to introduce that bill so that there is a choice out there. I think this kind of dialogue is great for America, whether you agree with the Obama bill or not. But if we agree that there needs to be changes, figuring out what to do and how to make the system better is what it's all about. I hear a lot of misinformation still about, there's one line that said this, and I get emails all the time saying, somebody said it's got this and that, and I think it's important to get the dialogue to a higher level to figure out what actually needs to be done and what the best way to go about it is, get a bipartisan acknowledgement of that and get to work on fixing it rather than just killing it. I mean, I think the idea of just killing everything is one way to go, but I don't think it's going to solve the bigger problem.
The whole concept and the whole belief in America that the Republicans are trying to kill this is hurting the Republican Party. So